I'm Linda. I'm the account manager for Northern Ireland for Benetton Health. And today we are hosting a webinar on blood pressure. And Linus is quite being very nice to offer to do it for us today, so which is great. And Linus is one of our clinical sisters with Benetton Health. And I'm just going to ask you all to put yourselves on mute and keep your cameras off. And I'll hand it over to you.
Lovely. All right. Thank you, Linda. That's very kind of you. Hi there. My name is Llenos Connolly. I'm the Clinical Services Sister at Benetton Health. So I'm based in the head office in York, but you probably can tell from my accent I am Welsh. And my background is I'm a qualified nurse. I've been qualified for about 20 odd years. Prior to this job, I just started this job quite recently, really. I started in October last year. So I'm still getting used to these webinar businesses. It's a bit nerve-wracking, but we're getting through that, and the anxiety is waning. But yeah, so today's discussion is going to be about blood pressure. So my background, I started saying that my background is I was a practice nurse for many years. I worked in primary care as a nurse manager in my last job in a GP practice. Before that, I worked in sexual health, HIV services, and some time in the ward and community as well. So today's session, it's about blood pressure, which is a very kind of topical thing because it's all the Department of Health are really hot about trying to reduce people's blood pressure so long-term health effects are improved for people. So in today's, so it's a little bit of introduction about what is your blood pressure, what is high blood pressure, what is low blood pressure, and what does blood pressure, a blood pressure read look like? Why is high blood pressure a problem? We'll be discussing some issues surrounding blood pressure and illnesses related to that. What factors affect your blood pressure, and a little bit about knowing your numbers and what can we do to improve your blood pressure as well. So, so let's get started. So what is blood pressure? Blood pressure is the measure of pressure in the arteries. Your arteries, they're the vessels or the tubes that carry the blood from your heart to your brain and the rest of your body. And you need a certain amount of pressure to get the blood moving around your body. So when your heart beats, the blood that is pumped around through the body exerts pressure against the blood vessel walls. And when your heart and blood vessels are healthy, these vessels kind of they're flexible, they expand and contract as well. So this expansion of and contraction of the vessels produces the blood pressure. When blood pressure vessels become less flexible or narrow, so they're the arteries, the heart has to pump harder to get the blood around the vessels. And this causes an increase in your blood pressure. So your blood pressure goes up and down naturally throughout the day, and it's normal for it to go up while you're doing exercise, if you're moving around. Sometimes it can get a bit higher if you're a bit stressed out as well. But it's when your overall blood pressure is always high, even when you're resting, that's when you need to do something about it. So blood pressure is measured using two numbers. So you've got the top button and the bottom number. And so the top number is something called the systolic pressure. And that's the higher of the two numbers. It's the pressure against the arteries when your heart is pumping blood around your body. And then you've got the lower figure, which is the diastolic pressure. So this is usually the lower number. And it shows how much pressure is within your arteries when your heart relaxes between the beats. Blood pressure is usually measured in millimeters of mercury, so mmHg. That's when you see it written down in medical terms. And the first number is usually about 120, and the second number is usually about 180. So it'll be written down as being 120 over 80 milligrams of mercury. And you might hear it if you're working on the wards, or if you're in your GP practice, they might say 120 over 80, and that's quite a normal blood pressure. That's a good blood pressure, and that's what I don't expect an adult to have as their blood pressure. So high blood pressure. So as I mentioned, your blood pressure pushes all your blood vessels. So sorry, start again. When your blood pushes against your blood vessels walls with too much force, it puts a strain in your heart and your blood vessels. This is called hypertension. High blood pressure is a serious condition. Your arteries, which are usually stretchy, so they can cope when your blood pressure goes up and down. But with high blood pressure, your arteries lose that stretchiness. They can become stiff or narrow. And high blood pressure or hypertension is an important risk factor for things like heart disease And many people might not know they've got symptoms of high blood pressure, and they might feel that they're absolutely fine, even though they might have high blood pressure. Those people with high blood pressure are more likely to have things like a heart attack or a stroke than those people with normal blood pressure. And this is because the narrowing, which makes it easier for the fatty kind of plaque or the atheroma to build up, and this narrowing damages the arteries, so the lining of the heart and the brain, and that can cause a life-threatening stroke or a heart attack. If it's left untreated, high blood pressure can lead to things like complications with your kidneys. So you might go into like kidney failure, heart failure. It might develop problems with your sight, and sometimes it can also lead to things like vascular dementia as well. So in most cases, there's no specific cause for high blood pressure, but most people develop it because of it could be because their diet, their lifestyle, or they might have an underlying medical condition as well. We all know people are more at risk of hypertension if they've got certain risk factors. That can be if you're over the age of 65, if you've got family history of high blood pressure, if you're a smoker, if you drink too much alcohol, if you have too much salt in your diet, you're not eating enough fruit and veg, you don't get enough exercise, or you might be overweight, particularly the midsection, the kind of visceral fat around your girth. That's an indicator you might be more susceptible to higher blood pressure. We also know that people who live in like deprived areas, research states they're also a higher risk of high blood pressure, and it can be based on ethnicity as well. So if you're of Black Caribbean or Black African descent, you might be a bit more higher risk for hypertension as well. You can have other causes or secondary hypertension, which is high blood pressure that can be caused by underlying health problems that might affect your kidneys, heart, arteries, or the endocrine system itself. So, sorry. So, so it could be secondary hypertension that can be caused by things like underlying health problems. So something called Cushing's disease, which is a disorder that occurs within the body because the hormone cortisol is persistently too high, and it's persistently high over a long period of time, and that's a stress hormone, and that can cause hypertension as well. So, and other things like hypertension in pregnancy is kind of linked to preeclampsia as well. So more than 1 in 4 adults will have high blood pressures, but some people might not know anything about it. Because most people don't know they may have high blood pressure because there aren't any obvious symptoms, and many people feel absolutely fine with it. But even if you feel fine, we do recommend that you have a blood pressure check, ideally once every 5 years, especially if you're over the age of 40. So within the NHS practice I used to work with, they used to do NHS checks from anybody between the age of 40 to 70. And you can book yourself in for that, and that's just a bit of an MOT, so you can get your blood pressure check, your BMI, height, weight, and some blood tests to check what your cholesterol and diabetic, and so that's well worth doing if you are over the age of 40. But if you do get some symptoms, I would say recommend it's a sign that your blood pressure might be quite high to get yourself booked in. So yeah, get your blood pressure done at least once every 5 years, because if you're increased from high blood pressure, you're more at risk on things like cardiovascular disease as well. If you have high blood pressure consistently, you might develop some symptoms. So you might get blurred vision, headaches, nosebleeds, and these, and that's usually, as I say, when your blood pressure is extremely high. Other symptoms of hypertension could be blood in your urine, fatigue, so that's when you feel tired all the time. Sometimes you might feel like palpitations, and that's when you feel at night especially that you can feel your heart racing. Or sometimes it can be linked to anxiety as well. Low blood pressure generally means that there's no problem, but it can be a result of other illnesses or something like somebody like in hypovolemic shock, and that could be a sign that their blood pressure is dangerously low. So So low blood pressure, medically known as hypertension, is when your blood pressure is 60, 90/60 or less. As I say, it doesn't necessarily mean there's a problem. In fact, people with low blood pressure, generally fitter, and they live longer than those with higher blood pressure, and is a bit more of an athletic blood pressure as well, that type of blood pressure. But you don't often have any kind of notable symptoms. Some symptoms can be, you might get dizzy, especially if you stand up, or you might be prone to fainting as well. So it could be a sign that your blood pressure is on the low side. But if your blood pressure is unusually low, your doctor should check to make sure that there's no kind of underlying medical cause behind it. Low blood pressure sometimes can be an effect for taking high blood pressure medication. It could be an indication of heart disease or sometimes depression as well. So if you've got a machine at home, there's some kind of guidance that we have from and this is taken from the Blood Pressure Society. So just basically, it's kind of common sense things really, but it's a quick and painless kind of procedure. Ideally, check it yearly, but it depends on your measurements as well. So if your blood pressure is a bit high and you're on medication, I would say check it a bit more regularly and keep a diary as well. We know that detecting high blood pressure early will improve a person's health. Your blood pressure can be measured by either a community pharmacist, a nurse or doctor, a healthcare worker in your GP practice, or you can buy a machine at home. So before you measure your blood pressure, I would always say to avoid the things that can make your blood pressure short in the short term. So sorry, if it makes your blood pressure high in the short term. So don't measure your blood pressure within half an hour of eating. If you smoke, try to avoid that. Try not to drink any kind of caffeine. Avoid exercise as well and carbonated drinks before your blood pressure is measured. If you need to use the toilet, obviously go to the toilet before your blood pressure is measured. Wear loose-fitting clothing if you do go to your GP practice, because sometimes that tourniquet can cause a fake kind of reading. So either wear a short-sleeved shirt or a t-shirt, or something you can pull up quite easily. Ideally, rest for about 5 minutes before you take your readings. So if you're going to go to a GP practice, just make sure you sit in that reception area about 5 minutes beforehand. Just get yourself in order and get your thoughts together, and because we know that things like white coat syndrome is a real thing, especially in GP practice. So we always say just to make sure you're giving yourself plenty of time. So just make sure when your blood pressure is taken, your arm is supported and it's the same level of your heart, and make sure that you're relaxed and comfortable as well. If you do measure your blood pressure at home, just follow the instructions that come with a monitor. The main thing is to make sure the cuff is just above your elbow, ideally about 2 centimeters above from your elbow, and that will detect the artery in your arm just under your skin. And when you have your blood pressure taken, the main thing is not to speak, just to keep still and quiet while you have it read, because if you move or if you chew, if you talk or laughing can make the effects of your blood pressure go up and down. So ideally, we like to get 2 or 3 readings with about 1 or 2 minutes apart, and you just write down the better figure out of all those 3 figures. And keep a diary of your blood pressure as well. So if you are prone to high blood pressure, as I say, it's better to know than not to know, and then we can do things to address that as well. So when you keeping a record will help you and your doctor see how your blood pressure has responded to treatments and lifestyle changes, and if you need to make any kind of changes in your treatments as well. So take a diary along to your appointments, and you can record your readings either in your phone or the memory of the monitor as well. Will keep a memory of your readings. But if you happen to share your monitor with someone else, obviously write it in your own personal diary so you don't get confused. And it's also helpful to note anything that might affect your blood pressure. For example, if there's any kind of changes in treatment, any episodes of illness, any symptoms that you have at the time, such as blackouts or feeling dizzy as well. So as a general kind of guide to blood pressure measurements, as the Department of Health are really hot about this now, and they would like for the patients' blood pressures to be less, because we don't want people to have stroke and long-term health problems. So ideally, your blood pressure, if it's 140 or 90 or higher, that's considered to be hypertension. So now they're really hot about getting people started on medication sooner rather than later. The kind of ideal range is between 120 over 80 to 140 over 90. But the higher it is, the more at risk you are from hypertension. So, and for those who have a blood pressure 90 over 60 to 120 over 80, that's the ideal kind of blood pressure. 90 over 60 is a low blood pressure, and that's not usually a problem, but it could be an indication of another health problem. So you might need some further investigations just to make sure that it's not anything related to like your kidneys and stuff. So we know there's hypertension related complications, so high blood pressure related complications, and persistent high blood pressure can increase the risk of some serious and potentially life-threatening conditions. And that includes heart disease, heart attacks. You're more susceptible to things like stroke or heart failure. You might be at more risk from things like aneurysms, kidney failure, retinopathy, and that's when you get problems with your vision. Or you might be more susceptible to things like type 2 diabetes and vascular dementia. High blood pressure can damage both the blood vessels leading to the brain, which affects the blood supply, and this type of dementia is called vascular dementia. You can also have problems with erectile dysfunction as well, because we know that those with high blood pressure can damage the blood vessels and restrict the blood flow to the penis, and leading to problems getting or keeping an erection as well. If you develop high blood pressure in pregnancy, or if you have a raised blood pressure before you become pregnant, your blood pressure will be carefully monitored, and we don't want anything like the risk of preeclampsia as well, because that can damage baby. If you have hypertension and diabetes together, that puts more of a risk for things like stroke and high heart disease as well, than having just one or one on its own. So that's why we always kind of say, if you have diabetes and high blood pressure, you need to be on a treatment for both and look at that lifestyle as well to improve kind of your long-term health. So it's not just the diet that affects your blood pressure, it's your lifestyle overall as well. So it depends on how active you are, whether you smoke and drink, and how much alcohol you have in your diet, for example. And this can all make a big difference. So in this section, we'll look at what affects your blood pressure and the best things you can do to lower your blood pressure naturally. So we know that alcohol and your blood pressure is kind of closely linked. Drinking too much alcohol will raise your blood pressure over time. And if you're a heavy drinker, it raises it further. So you've got to think about alcohol contains lots of calories, which will make you gain weight, which will in turn raise your blood pressure as well. So there's no amount of alcohol that can be thought to be safe, but the government advises that you have about 14 units a week, and that's for men and women. So 14 units is roughly about 6 pints of beer, or maybe a bottle of wine. So if it's say a 40% bottle of wine, that's be 14 units. If a 10% bottle of wine, that'd be 10 units. So the Department of Health recommend 14 units for men and women over the week, and ideally to have alcohol-free days as well in your life. Just so if you like kind of say like, my drinking day is going to be on a Thursday and Saturday nights, and then Monday, Tuesday, Wednesday, and Friday night, I'm not going to drink. So just setting some times in your life where you don't have any alcohol at all. Ideally, try to avoid drinking more than 6 units in any one session. And if you drink more than 6 units, that's classed as binge drinking. So if you think about that, that's less than 3 glasses of 3 small glasses of wine, about 175 mils in a small glass. So it's less than 3 glasses of small wine. So on top of medication and healthy lifestyle changes, there are other things that you can help to reduce your blood pressure even more. So we know things like salt and the reduction of salt in your diet will help as well. So the Department of Health recommends 6 grams of salt a day in your diet. So that will be a teaspoon of salt. So when you cook your food, I would always say not to add salt to your food when you cook, add it at the table. And that would help protect your heart as well. If you smoke currently, I would say try get help to stop smoking, because that's probably one of the better lifestyle changes you can make. It's really hard. I'm an ex-smoker myself. Linda and I were having that good chat last week about how hard it is to stop smoking. But the more times you try, the more likely it is that you quit. And even if you vape and stuff, that is better than smoking cigarettes. But if you vape, just make sure that you cut down the amount that you vape and gradually wean yourself off all kind of nicotine as well. Ideally, the best thing to do is just to be on nicotine replacement therapy and you can get that from your GP practice sometimes through the smoking cessation team. To try to eat plenty of fruit and veg a day. So I would say, at least everybody knows this, but 5 portions of fruit and veg, more vegetables than fruit ideally, because the fruit in sugar, the sugar in fruit can make your blood sugars go up as well. So I would say have 3 pieces of veg and 2 pieces of fruit a day. If you need to lose weight, make some active kind of choices to do that as well. So either increase the amount of exercise every day. So as I say, Department of Health recommend 150 minutes of exercise a week. So it equates to about 30 minutes of exercise a day. So you can incorporate that with a brisk dog walk or cycling to work, and try to incorporate that into your kind of normal lifestyle as well. And ultimately look at your stress levels and take time to relax. Try to be your own best friend. Do things that you enjoy. It could be just watching TV at night or reading a book, catching up with friends, going to the cinema, painting, yoga, meditation. Just do something that's for you, at least half an hour a day as well. And ultimately, if you need to, look at your sleep hygiene as well. So try to get at least 6 hours sleep a night, just to make sure that you've got yourself into good sleep habits. Try to go to bed about the same time every night and wake up at the same time every morning. So I've got this in my head. I go to bed no later than 11 o'clock. I'm up at 7 o'clock, and even at the weekends, which is a bit of a change from my life, because I used to like a line in the weekend, but now I'm like, no, we'll just do that. And you do get into that kind of sleep hygiene habit as well. So simple lifestyle changes can reduce blood pressure, although some people might need to take medication as well. So your GP or your kind of community pharmacist, or the pharmacist that works in your GP practice, can advise you about changes that you can make to your lifestyle. A practice nurse can do this as well, and they'll discuss what you might benefit from medication. So there are several types of medication that can help control high blood pressure. If you're under the age of 55, or if you have type 2 diabetes, you'll usually be offered something called an ACE inhibitor. And this can either be something like lisinopril, ramipril, or an angiotensin type 2 receptor, or an ARB. So that's your kind of statin or low statin. You can get side effects associated with these type of medication. Most commonly, you might get things like dizziness or headaches, or you might develop cold-like or flu-like symptoms as well. You also can get something called ACE inhibitors, and that's reduce the blood pressure by relaxing the blood vessels. This is the most common side effect from this type of medication is a persistent dry cough. Other side effects can be a headache, dizziness, and sometimes you might develop a rash as well. But if, however, you're over the age of 55, or if you have an African or an Afro-Caribbean origin and you don't have type 2 diabetes, you might be offered something called a calcium channel blocker. So the calcium channel blockers reduce blood pressure by widening the blood vessels. So common examples of this could be amlodipine, nifedipine, or felidopamine as well. Other medications such as diltiazem are also available as well, but it depends on your kind of, it's be specific to your kind of ethnicity or your age and the underlying health problems. But they all have kind of the same side effects as headaches. You might feel dizzy initially. Some people might be given diuretics. So diuretics are also known as water pills, and that helps by flushing excess water and salt from the body through your wee. Or you might be given something like a beta blocker as well. Beta blocker can help your blood pressure by making your heart beat more slowly with less force. This used to be a really popular blood pressure treatment, but now they tend to use this when other treatments haven't worked. So it's probably a last resort treatment. And that's purely because they consider beta blockers to be less effective than other blood pressure medications. So that's your atenolol or bisoprolol as well. So I've whistled through that quite quickly. Should we stop recording, Linda? Would that be okay? And then we'll see if